Hello everyone, I'm Dr. Aman and welcome to my channel. Today we are diving into an essential topic that every medical student must know. The topic is Vacutainer Tubes. Whether you are in a pathology, internal medicine or just starting in your clinical rotation, understanding these color-coded tubes is crucial for proper sample collection and for the diagnosis. Now, as you shown in the picture, these are the different color-coded Vacutainer tubes. Now, what are Vacutainer tubes? So, what exactly the Vacutainer tubes are? They are the sterile blood collection tubes used to collect, transport, and sometimes preserve blood sample for laboratory testing. The Vacutainer tube is invented by Joseph Kleiner in 1947. These are only for a historical purpose. Now, what a Vacutainer tube includes? The Vacutainer system includes a double-ended needle, a plastic holder, and the vacuum seal tube. Have you ever wondered why these tubes have different color-coded cap? As you see in the picture, each tube has a specific color code cap that indicate the type of additive inside, which determine the type of test that will be performed. Let's break down the most common Vacutainer tubes you will encounter in your clinical practice. Let's start with red color cap tube. There is no anticoagulant in this color tube. Why there is no anticoagulant? Because the blood clots naturally and serum is separated after the centrifugation. It is used in LFT, liver function test, RFT, renal function test, serum electrolytes, lipid profile. Now, let's discuss about its duration and stability. Serum is stable for 24 to 48 hours at 2 to 8 degree Celsius temperature, longer if frozen. The second tube is gray color cap tube. The anticoagulant present in this tube is sodium fluoride plus potassium oxalate. Now, what's the mechanism of this anticoagulant? Sodium fluoride inhibits glycolysis, which prevents breakdown of glucose, and potassium oxalate act as an anticoagulant by precipitating calcium. It is used in glucose estimation or HbA1c. Now, let's discuss about the duration and stability. Glucose stable up to 72 hours at room temperature. The third tube is purple lavender color tube. The anticoagulant present in it is EDTA. The mechanism of EDTA chelates calcium, which prevents clotting. It is used for complete blood count cell, that is CBC, ESR, erythrocyte sedimentation rate, CRP, C-reactive protein, peripheral smear. The duration of this is CBC is stable for 6 to 24 hours, room temperature. Smear should be made within 2 hours. The fourth color cap is blue color cap tube. The anticoagulant present in it is 3.2% sodium citrate. The mechanism behind it binds calcium, prevents clotting, but reversible after adding calcium back in lab. It is useful for coagulation studies. What is in which diagnosis it is used? It is for prothrombin time or APTT, activated partial thromboplastin time, or coagulation studies. The duration of this tube is stable for 4 to 6 hours at room temperature. Plasma can be frozen for longer storage. There is an important note for you. Ratio of blood and anticoagulant must be 9:1. Now the green color tube. The anticoagulant present in it is heparin or lithium or sodium heparin. Mechanism, it inactivates thrombin and factor XA, which prevents clotting. The uses are for bone marrow studies, cytogenetics, special chemistry like hormones, electrolytes, ammonia, carboxyhemoglobin. The duration for this is plasma stable for 48 hours at 2 to 8 degrees Celsius. The another color is yellow color cap tube. The anticoagulant present in is citrate. Citrate, either sodium citrate or ACD or SPS depending on the type. The mechanism is it binds the calcium and prevents the clotting. What the uses are? The uses are blood culture like SPS, sodium polyethanol sulfonate, or inhibits complicants and antibiotics. HLA typing, DNA studies, ACD tubes, these are used in this purpose. Duration, the duration is blood culture incubated immediately and remain visible for days. Our last tube is pink color cap tube. The anticoagulant present in is K2-EDTA. Now reminder that in purple color there is anticoagulation EDTA, and in pink color there is coagulation K2-EDTA. What the mechanism behind is, it's chelates calcium. Uses blood bank test, blood typing and cross matching, ABO and RH grouping. Duration stable up to 24 hours in room temperature, and if refrigerated, it will be longer storage. So friends, these are the basic knowledge of a Vacutainer tubes.